Thank you for joining us for today's Practice Advantage Pearl. Today we have Dennis Wipperling with us, a seasoned healthcare leader. Dennis has experience both with single specialty and multi-specialty practices in a number of different settings, including integrated healthcare delivery systems, hospitals, as well as single specialty clinics, as well as multi-specialty clinics, both large and small. Dennis's current employment is with a single specialty practice in St. Paul, Minnesota. Today's topic is talking a little bit about getting from the vision or the strategic plan to action, actually implementing that. So if we think about Jim Collins and his book, Getting from Good to Great, we want to pick up some pearls. So Dennis, how does a practice take the strategic plan and get from good to great?
Dale, a strategic plan is like an itinerary for a multiple-day cross-country road trip. With all the external change affecting medical practices, the strategic plan is a tool to help the practice stay focused on their priorities and to be proactive with the change. It helps the practice move from vision and ideas to action. The plan should be developed with other providers and with key staff members so that they have ownership in the plan. Quite often, also, when the plan is developed and the final strategic document is finished, it'll just kind of find its way on a corner of a desk or put in a file cabinet, and quite often, and more often than not, is not implemented. Two quick examples. Years ago, I was hired as the executive director for a large multi-specialty physician-owned clinic. And when I started, I asked if they had a strategic plan, and I found that they had developed a 5-year strategic plan, but it was done 7 years prior. And once examining the plan, I found that of the 5 strategic initiatives, 3 of those were completed, and they were fairly significant initiatives, including adding a clinic location, adding a service like urgent care, and changing out their accounting system. Contrast that with the other example where I have seen, and unfortunately this happens quite often, where a practice paid an outside consultant a fair amount of money to lead them through strategic planning and develop a strategic plan. And when completed, they had this plan, which they really didn't know what to do with, and it went into a file cabinet. So the important thing for practices that once a strategic plan has been completed is to take the strategic initiatives and create action items so that there's a high success of accomplishing the strategic initiatives. Let me give you an example. Say, for example, a practice was looking at implementing by mid-September their strategic initiative of growing the number of new patients seen per month from 25 to 50. The first action item on their action plan may include defining how to measure or record new patient visits. The responsible person for that would be possibly the business office supervisor, and the target date for that to be accomplished, which could happen fairly quickly, would be let's say, for example, September 28th, just really roughly a week or a week and a half out. So the action plan, as you see from this example, is detailed and includes the particular action item, who's responsible, and a target date. A second item on this action plan for increasing the number of new patients may be ensuring that there are enough new patient appointment slots. The person responsible for that probably will be the front office lead or supervisor and probably the lead physician. And there, too, the target date for completing that should be fairly soon, probably October 1. A third action item would be to visit a minimum of 5 referring practices that currently are not referring patients to this practice. The person responsible for that would be the lead physician, and the target date, again, for this example, could be November 1. In these examples, you see the importance of having measures and knowing whether the practice is on track in accomplishing what they hope to accomplish. The second thing you understand from this example is the importance of everyone understanding the strategic initiative. In this example of growing the number of new patients, if the schedulers do not realize the importance of that strategic initiative, and if they're not friendly and accommodating and offer appointment times that are acceptable to the referring physicians, that entire strategic initiative may be compromised, again, because of the actions of one individual. One other thing that is important for ownership of the strategic initiatives is to celebrate and recognize milestones along the way. So when an action item is accomplished, acknowledge that, particularly the individual who is responsible for that, and share that with all the other people. And particularly when the strategic initiative is accomplished, for example, seeing one success practice, using that example, is seeing 50 new patients per month, to really celebrate that and engage everyone in that celebration. The strategic plan helps move the practice from vision to action and allows the practice to be proactive in this time of change.